Cameron Diaz at age 51 just had her second baby. And while I agree with this headline that it's really none of anyone's business how it happened, what is my business as a board certified fertility doctor is to ensure that anyone who happens to read a headline like this isn't mistaken in thinking that technology has improved to the point where it is easy to get pregnant at age 51. I mean, with your 51-year-old eggs. I think celebrity pregnancy announcements are a double-edged sword. On one hand, I love seeing headlines about fertility and women's health, and I think talking about fertility treatments when it comes to celebrities can help lift stigma to understand, stars, they're just like us. It doesn't matter who you are. Anyone can have to deal with infertility, especially age-related. But on the flip side, when you see things like this, it's a headline that doesn't give the full picture, full story. And I can tell you that as a fertility doctor, there have been countless numbers of times that women have come to me in their late 40s and sometimes even their early 50s where they say things like, well, Janet Jackson did it, or, how are all these other people doing it? And they don't realize that most of the time, I'd say the majority of the time, these people are using eggs from when they were younger. They were frozen from when they were younger, or they're using embryos that were frozen from their eggs when they were younger. And a lot of the times they're still using donor egg. I think now as we get to a point where egg freezing has been around for several decades, and vitrification, which is the superior egg freezing technology, and embryo freezing technology has been around for many decades, we are going to start seeing these types of stories involving people using their own eggs more and more. Now, it's definitely possible that Cameron Diaz froze her eggs, let's say, 20 years ago, in her 30s. That would have been in the early 2000s. Vitrification really came about in the 2010 plus era. So who knows, but it's all speculation at this point. I guess the point is that no one should be overconfident that there are ways to overcome the egg quality issues that we see arise from age. And we know all too well that IVF is not a guarantee, and it's not always going to be able to overcome that, because at older ages, especially close to 50, you're going to have a very low egg count, a lower response to treatment, and a large majority of the eggs will be abnormal as embryos. Now, Cameron Diaz used a surrogate or a gestational carrier for her first pregnancy. There's no information on whether she did again for baby number 2, but I wouldn't be shocked if she didn't and she was able to carry, because I've said it once and I'll say it again, folks, the uterus doesn't age. Your ability for an embryo to implant and stay implanted is not related to your age. Even when you hit menopause and your ovaries no longer function and make the necessary hormones, we can give you those hormones to support the early pregnancy until the placenta takes over between 7 to 10 weeks. You could have your ovaries surgically removed and I could still get you pregnant. But let's be very clear that this doesn't mean it's completely benign to carry a pregnancy in your early 50s. There are much higher rates of issues like stillbirth, needing a C-section, diabetes in pregnancy, high blood pressure in pregnancy. And while there have been small studies that have shown reasonable outcomes that are not that different from women in their 40s, it's still considered a really high-risk pregnancy. And there are also ethical questions about what is the upper limit of an individual or a couple when it comes to age, and will they be reasonably able to raise their child into adulthood? So yeah, there's lots to think about, and that's exactly why you should never take headlines like this at face value.